classic view of the storybook medieval life. We don't hear the stories about the common man trying to keep his family alive.
In our stores, there are hundreds, if not thousands, of skeletons.
Archaeologically speaking, we can now focus in on the medieval dead people.
You're looking for clues in the skeleton all the time.
And you couldn't help almost look through their eyes thinking, what did they see? How did they die?
In the shadowed corridors of time, where empires rose and fell, the Inca civilization mastered a surgical technique that would baffle modern medicine. Without anesthesia, antibiotics, or steel, they performed brain surgeries with a success rate that eclipsed even the Civil War's battlefield doctors. How did an ancient society achieve such medical prowess? Prepare to journey into the heart of the Andes, where secrets etched in skulls challenge our understanding of history.
When archaeologists started digging up 7,000-year-old skulls with healed-over burr holes, they realized they had proof of the earliest surgery. Historians believe that fractured leg bones were splinted before that, and that stitching together of laceration wounds probably is as old as stitching of clothing, which is in the 150,000 years ago range.
The skull whisperers of the Andes. High in the Peruvian Andes, archaeologists unearthed a chilling discovery. Over 800 skulls bearing precise holes, evidence of trepanation, a surgical procedure involving the removal of a portion of the skull. Remarkably, many of these ancient patients survived, as indicated by bone regrowth around the openings. This survival rate, reaching up to 90% during the Inca period, starkly contrasts with the 46 to 56% mortality rate of Civil War cranial surgeries. What knowledge did the Inca possess that allowed them to excel where others failed? Swiss Iron Age neurosurgeons. In 2015, archaeologists in Switzerland uncovered a burial site containing trepan skulls dating back over 3,000 years. These skulls had clean, round holes cut into the cranium, evidence of intentional surgical intervention. What stunned researchers most wasn't the presence of surgery itself, but how many patients survived. Nearly 80% of the skulls showed signs of healing, meaning the individuals lived for months, even years, after the procedure. This was no crude accident. It was deliberate, refined surgery. How did Iron Age tribes, lacking antibiotics and anesthesia, achieve such results? Some scientists speculate that they used herbal antiseptics derived from alpine plants and employed flint or bronze tools honed to razor sharpness. The procedures appear to have been performed to relieve cranial pressure from trauma or neurological issues. Compared to their contemporary European counterparts, these Iron Age Swiss surgeons demonstrated surprising competence and survival rates that rivaled some 19th century field hospitals. Were these mountain tribes operating on lost knowledge or ancestral wisdom rediscovered? Egypt's 4,000-year-old tumor removal. In 2024, researchers published findings from a stunning Egyptian discovery, a 4,000-year-old skull with a large cancerous lesion and marks of surgical scraping around it. Unearthed near the necropolis of Giza, the skull belonged to a middle-aged man who had undergone a primitive form of tumor removal. This wasn't merely post-mortem damage. Under microscopic analysis, scientists found clear tool marks consistent with deliberate medical cutting, not trauma. While there's no evidence the patient survived, the fact that someone attempted to remove a cancerous mass shows remarkable anatomical understanding. Ancient Egyptian medical papyri, like the Edwin Smith Papyrus, already documented surgeries and diagnoses, including head wounds and tumors. But this is the first archaeological proof that such procedures were physically attempted. Was this the work of an elite physician, perhaps one trained in temple schools under Imhotep's legacy? The implication is profound. Ancient Egyptians didn't just diagnose, they operated. How much surgical knowledge did they lose when their empire fell? Chapter: Roman Battlefield Surgeons. The Roman Empire was built through relentless military campaigns, and with them came battlefield injuries. To treat these wounds, Roman military medici developed an early form of trauma surgery. Excavations at Roman forts like Vindolanda and Herculaneum unearthed surgical kits containing scalpels, bone levers, and forceps. These tools were forged with precision, resembling modern instruments. The surgeon Celsus described treating arrow wounds and dislocations, often using boiled instruments and wine as antiseptic. Roman battlefield medics were quick, efficient, and surprisingly advanced for their era. Their success raises questions. Did Roman surgeons develop these practices independently or inherit them from older civilizations like Greece or Egypt? The healers of ancient Egypt. Ancient Egypt's reputation for mysticism overshadows its advanced medical knowledge. As early as 2600 BCE, Egyptian doctors documented treatments for wounds, infections, and even dental problems. The Edwin Smith Papyrus, believed to be a surgical manual, included detailed case studies on trauma, immobilization, and prognosis. Physicians employed honey as an antibacterial agent and stitched wounds using linen threads. Some practices, like cauterization, are still used today. Temple-sanctioned healers blended empirical medicine with spiritual rituals, believing both were essential to recovery. They categorized injuries, understood symptoms, and approached treatment systematically. Their legacy influenced Greek and Roman medicine and reveals that Egypt wasn't just building pyramids, it was also pioneering clinical care. India's plastic surgery pioneers. In ancient India, centuries before modern plastic surgery was born, a physician named Sushruta was performing complex reconstructive procedures. In the Sushruta Samhita, one of the oldest medical texts, he detailed surgeries, including rhinoplasty or nose reconstruction, often necessary due to punishments involving nose mutilation. Using skin flaps from the forehead, Sushruta's method resembles modern techniques still in use today. He also described cataract surgery, wound suturing, and the sterilization of tools with heat and alkalis. These practices date back to at least 600 BCE, showcasing a startling level of anatomical understanding. Patients were often sedated with wine or cannabis, while assistants restrained their movements. The precision, hygiene, and methodology suggest a thriving surgical tradition. Was this knowledge isolated in India, or did it ripple through trade routes to influence distant civilizations? The tooth pullers of Mesopotamia. Over 4,000 years ago, in the heart of Mesopotamia, dental care was already underway. Clay tablets describe painful afflictions blamed on toothworms, a theory held for centuries. Priests and healers offered remedies combining herbs like garlic with spells to banish the pain. Archaeologists have found drilled molars and teeth packed with bitumen, an early form of filling. While crude by today's standards, these practices show that even early civilizations treated cavities, extractions, and infections. Their tools were basic, but their intention clear: stop the pain, save the tooth. Were they the world's first dentists, or just desperate? Bronze Age prosthetics. In 2000 BCE, long before modern prosthetics, Egyptians crafted wooden toes and sandals for amputees. One example, a prosthetic toe made from leather and wood, was found on a mummy near Luxor. It wasn't just decorative, it fit snugly into a sandal, showing it was meant for walking. Rome's underground lifeline. The Romans didn't just build empires, they built sewers. The Cloaca Maxima, begun in the 6th century BCE, is one of the world's oldest and most advanced sanitation systems. Designed to drain Rome's waste into the Tiber River, it helped prevent disease by keeping streets and homes clean. Public latrines, often communal and surprisingly sophisticated, were connected to these massive underground tunnels. Flowing water from aqueducts washed waste away, showcasing a clear grasp of hygiene's importance. While not sterile by today's standards, the system greatly reduced contamination in dense urban areas. Was this ingenuity purely practical? Or did Rome glimpse early public health science, temples of healing in ancient Greece? Long before modern hospitals, the Greeks had the Asclepiae, healing temples dedicated to the god Asclepius. Patients traveled from across the Mediterranean, seeking cures through ritual, rest, and early medical treatment. These sanctuaries offered clean water, controlled diets, and even minor surgical care. The sick would sleep in incubation chambers, hoping for divine dreams that priests interpreted into treatments. At Epidaurus, inscriptions detail successful recoveries from blindness, paralysis, and wounds. While steeped in religion, these centers functioned much like hospitals, combining observation, treatment, and recovery. Were these spiritual sites the ancestors of clinical medicine, or something even more holistic? Ayurvedic dissections and surgery. In ancient India, Ayurvedic scholars conducted human dissections, an unusual practice for its time. The Sushruta Samhita, compiled around 600 BCE, details not only external surgeries, but internal anatomy, surgical tools, and dissection methods using river-soaked corpses. Sushruta described over 300 surgical procedures, including bladder stone removal, bone setting, and eye surgery. Students were trained rigorously, often practicing on fruits and animal tissue. Despite spiritual beliefs about the sanctity of the body, this bold tradition marked a leap toward empirical medicine. Was this a singular achievement, or part of a larger, now lost global medical dialogue? Mummification as medical science. Ancient Egyptian mummification wasn't just ritual, it revealed deep anatomical knowledge. Embalmers removed organs, treated tissue with resins, and preserved bodies with extraordinary precision. To do this successfully, they had to understand internal structures, organ decay, and preservation techniques. Some scholars believe embalmers were unofficial anatomists, passing knowledge to physicians. Surgical instruments found in embalming workshops resemble medical tools. Could centuries of preparing the dead have inadvertently trained generations of healers? The line between ritual and science blurred, raising a striking possibility that Egypt's mortuary art also served as a classroom for medical discovery. The San Healers of Southern Africa. For thousands of years, the San people, among the oldest continuous cultures, have practiced medicine rooted in observation, ritual, and ecology. Using over 300 native plants, they treat everything from infections to snake bites. Their healers are trained through visions and mentorship, diagnosing illness via trance dances and herbal tonics. Their pharmacopoeia includes plants now recognized for antimicrobial and analgesic properties. While dismissed for centuries as superstition, modern ethnobotany is beginning to validate their methods. Are the San's ancient remedies proof that deep environmental knowledge can rival laboratory science? Their oral tradition holds centuries of medical wisdom, barely scratched by researchers. The ancient Maya weren't just fierce warriors, they were skilled battlefield medics. Evidence from murals, burial sites, and tools suggests they treated arrow wounds, fractures, and blunt force trauma with surprising effectiveness. Obsidian blades were used for surgery, while poultices, made from honey, tree resins, and chili, helped disinfect and numb injuries. Some warriors even returned to battle with mended skulls and healed fractures. Healers, known as men, were both spiritual guides and practical doctors. Bones showing signs of surgery suggest they attempted trepanation and bone-setting techniques. Their knowledge, though framed in a spiritual context, was rooted in experience and keen observation. How much Maya medical knowledge was lost in the Spanish conquest, and how much remains buried in the jungle? During the Islamic Golden Age, cities like Baghdad, Cairo, and Damascus established hospitals centuries ahead of their European counterparts. Known as bimaristans, these facilities offered free care, separated wards by illness, and even maintained medical records. Physicians like Al-Razi and Ibn Sina advanced diagnostics, surgery, and pharmacology. Patients received treatment regardless of class or religion, a radical idea at the time. These hospitals were clean, organized, and emphasized rest and recovery. They also doubled as medical schools, training generations of physicians. Were these institutions the true birthplace of modern clinical care? Their legacy still echoes in today's hospital systems: Viking wound care and battle surgery. The Vikings are known for conquest, but less so for their battlefield medicine. Excavations in Scandinavia have uncovered tools for cauterizing wounds and bones showing signs of surgical intervention. Vikings likely used moss and honey as antiseptics and birch bark for pain relief. Saga texts mention wound treatment, surgical cautery, and even amputations. In one tale, a warrior examines a wound by tasting the blood for organ damage. Legendary maybe, but based on real battlefield triage. Viking medicine wasn't refined, but it was pragmatic. Did these seafarers develop their own surgical traditions or borrow knowledge from the lands they raided? Medieval barber surgeons. In medieval Europe, if you needed surgery, you went to the barber. These barber surgeons cut hair, pulled teeth, set fractures, and even performed amputations. Recognizable by their red and white pole, symbolizing blood and bandages, they worked in towns and battlefields alike. While lacking formal training, many were skilled from experience. Bloodletting was common, as was trepanation and cautery. Monastic hospitals provided support, but barber surgeons did the hands-on work. Their reputation wavered between lifesaver and butcher, yet they laid the groundwork for modern surgery. Was their rise out of necessity or a reflection of the Church's ban on clergy performing surgery? The Aztecs maintained one of the most advanced herbal pharmacopoeias in the pre-Columbian world. The Badianas manuscript, a 16th century document, records hundreds of plants used to treat fever, wounds, rashes, and internal ailments. Aztec healers, Tisitl, used chilies as antiseptics, maguey sap for wound care, and hallucinogenic herbs for pain and rituals. They categorized plants with surprising precision, creating remedies based on observation, not magic. Some of these treatments have since been validated by modern pharmacology. Their knowledge was so respected, Spanish physicians preserved it. How much more wisdom was lost in conquest and colonization? Public health in the Indus Valley. More than 4,500 years ago, the cities of Mohenjo-Daro and Harappa in the Indus Valley had grid-like streets, flush toilets, and covered drainage systems. Homes were connected to centralized sewage networks, an unparalleled level of sanitation for the time. Unlike in other ancient cities, waste was carried away from living areas, reducing disease spread. This suggests not only engineering skill, but an early understanding of public hygiene. Yet we know little about their medical practitioners. No temples, no inscriptions on surgery. Did they separate health from religion. Their silent efficiency raises questions. Was the Indus Valley the world's first hygienic civilization? In the 11th century, Persian physician Avicenna revolutionized medicine with his encyclopedia, the Canon of Medicine. Drawing on Greek, Roman, and Indian sources, it became a cornerstone of medical education for centuries. Avicenna emphasized empirical observation, and his book covered diseases, anatomy, pharmacology, and surgical practices. He introduced concepts like quarantine and clinical trials long before they were mainstream. His hospitals employed rotating doctors and maintained patient records, radical ideas for the time. Translated into Latin, the canon shaped European and Islamic medicine alike. Did Avicenna foresee principles of modern science centuries before the Enlightenment? Among Andean cultures, shamans didn't just chant, they cut. Some performed rudimentary surgeries, including trepanation, to treat trauma or release evil winds. Using stone tools and coca leaves for pain relief, they operated with surprising precision. Skulls from pre-Inca cultures, like the Paracas, show signs of healed cranial surgeries. Shamans combined herbal pharmacology with spiritual rituals, invoking mountain deities for guidance. While grounded in mysticism, their techniques often worked. Were they intuitive healers or the world's first neurologists? Their legacy suggests that blending faith and science isn't as modern or as contradictory as it might seem. Medieval leper hospitals. In medieval Europe, leprosy was feared and misunderstood. As the disease spread, leper colonies, called leprosaria, emerged outside city walls. Despite isolation, many of these centers offered structured care, food, and even basic medical treatment. Operated by monastic orders, they maintained surprisingly detailed patient records. Lepers often received herbal remedies, spiritual counsel, and wound management. While the care was limited, these institutions reflected a moral duty to the sick. In many ways, they foreshadowed modern public health responses to contagious diseases. Did medieval societies understand quarantine better than we thought? East African herbalism and bone setting. In East Africa, traditional healers called waganga have practiced medicine for centuries. Especially renowned for bone setting, these healers use massage, splints made from reeds or bark, and tightly bound wrappings to mend fractures. Ethnographic studies show they treat dislocations and breaks with impressive accuracy, often without X-rays. Combined with herbal remedies, aloe, neem, and turmeric for inflammation, they offer holistic care that blends anatomy, experience, and spirituality. In rural areas, such practitioners remain the first line of treatment. Some African orthopedic surgeons today credit them as inspiration. Could ancient bone setters rival modern techniques in function, if not form? Ancient Egyptian women gave birth seated on birth bricks, while surrounded by midwives and ritual incantations. The process blended medical care with divine protection, especially from Taweret, the hippo goddess of childbirth. Tools like knives, linen wrappings, and herbal infusions were standard. Papyri reveal formulas for inducing labor, treating postpartum hemorrhage, and contraception using crocodile dung or acacia. While some remedies seem outlandish today, others, like honey for infection, are supported by modern science. Childbirth was risky, but managed with intention and ritual. Did the ancients rely on magic, or did they understand more than we give them credit for? In 17th century Europe, plague doctors became grim icons of early epidemiology. Their infamous beaked masks weren't just theatrical. They held herbs like lavender or cloves to filter the air, based on miasma theory. The long coats, gloves, and canes formed one of history's first biohazard suits. While the science was flawed, the approach showed awareness of contagion and personal protection. Plague doctors recorded cases, performed autopsies, and even quarantined the sick. Their eerie image persists, but behind the mask was a real attempt at infection control. Were these doctors charlatans or early public health pioneers? Long before recorded history, Neolithic Europeans performed skull surgeries with flint tools. Excavations across France, Ukraine, and the Balkans have uncovered trepanned skulls, some with up to 5 holes. Astonishingly, many show signs of healing. The purpose remains debated. Was it to relieve pressure, treat seizures, or expel spirits? Whatever the reason, the precision indicates practiced hands. These weren't random holes, they were surgical. With no written language, all we have is the bone. Could these early farmers and herders have stumbled upon effective brain surgery thousands of years before Hippocrates? Among the cuneiform tablets of ancient Mesopotamia lies the world's first known medical literature. Written in Sumerian and Akkadian, these clay tablets from around 2100 BCE outline symptoms, diagnoses, and remedies. The texts separate magical and physical causes, an early attempt at differential diagnosis. Treatments included enemas, poultices, and incantations, often prescribed together. One famous tablet describes epilepsy as the hand of a ghost, showing the blend of spiritual and empirical thinking. Despite primitive understanding, these texts laid a foundation for clinical documentation and specialist roles. Medicine, even then, was a profession built on memory and records in baked clay. From the Andes to the Nile, the scalpel to the chant, humanity has always sought to understand and heal itself. These ancient practices weren't primitive accidents. They were systems built from observation, trial, belief, and necessity. Many outperformed modern expectations. Some still influence medicine today. They remind us that innovation isn't confined to modern labs. It's woven through the bones, scrolls, and rituals of our ancestors. So the next time you enter a hospital or swallow a pill, ask yourself, how much of what we know began in a world lit by firelight and guided by instinct?